All right, ladies, January is Cervical Health Awareness Month. So what I'm going to do is, because I care about you all, Trey loves the kids and Trey loves the women as well. Trey loves all y'all. I got Dr. Shanicka. Dr. Shanicka, how you doing today?
I am doing well. How are you?
I'm pretty good. Dr. Shanicka is a beast, ladies and gentlemen. She travels from state to state. She's a mobile doctor.
Oh, my goodness. I am licensed in 15 states.
15 of them. Okay.
But they're all listed on my website.
Okay. Her website is www.drshanicka.com. That's SHANICKA. And she's going to be with me every week just to let you guys know. A lot of y'all don't go to the doctor. And, I know that. So I'll help you guys out by listening to the radio, playing all that gangster hip-hop music that you like, and enlightening you on your health as well. All right? So Dr. Shanicka today is going to talk about cervical health. Now, first of all, for ladies out there, now, cervical cancer, how common is it for women? You know how they give the statistics?
Yeah, absolutely. So cervical health or cervical cancer, actually, about 11,000 women are diagnosed with cervical cancer each year. Mm-hmm. But the part that really gets me is that it truly affects African-American women and Hispanic women in a worse fashion, okay? It is a health disparity, okay? So usually cervical cancer is 45% higher among Black women and 65% higher among Hispanic women.
Let me jump in real quick. Why is that for minorities?
So it's actually quite a few reasons that it actually happens. Part of it is because we don't have access to care. So we have individuals that live in, you look at socioeconomic status, and we sometimes tend not to go to the physician as often as we should. And then there's actually lack of knowledge of when you're supposed to go. When are you supposed to get screened for pap smears? Okay, so sometimes when we don't have the knowledge, we can't do better, right?
Right.
Sometimes we have, it's mostly community driven. So if your primary care physician in your community is not stressing the importance of pap smears and, why you should get them done, then, that community is at a loss and they won't get that screening done.
How often should a woman get a pap smear?
So there are actually new rules to when a woman should get screened for cervical cancer, okay? So a woman is supposed to go in, okay, every 3 to 5 years, okay? And there have been some changes as well to the age people are supposed to go get screened, when women are supposed to get screened.
Okay.
So the new recommendation is for any woman between the ages of 21 to 65, okay? Women 21 to 29 are to get for 3 years, and that's just the cytology. They just go and get it. They scrape the cells off the cervix so that they can, see what's going on with the cervix, see if there's any changes, and that's every 3 years. We actually do the HPV testing when you turn age 30. The reason that is because 21 to 29, you're pretty young, you're pretty healthy. Usually you're able to clear the HPV, which is human papillomavirus, the virus that causes cervical cancer. So if you're able to clear it, then we don't really test for it just yet. It hasn't been shown to be really effective to test that early. But once you turn 30 to 65, we're testing the cytology, the cells, as well as testing for HPV.
I don't want to seem stupid or ask stupid questions because I'm a guy, but are there ways to keep your cervix healthy?
Oh, absolutely. So condom use. So HPV is a sexually transmitted virus. It is the human papillomavirus. It causes cervical cancer. Not only does it cause cervical cancer, now this is something that a lot of people don't know, but it also causes symptoms in men. It causes men to have penile cancer, okay? So it's important that when you are sexually active with a person that you are definitely using a condom. Now, just so you know, condoms do not protect 100% from this particular virus, this HPV virus, simply because it can be on any part of the genital area, including the pubis, okay? So it still can be sexually transmitted. Okay, not only does it cause penile cancers, not only does it cause cervical cancer, but it can also cause warts as well.
Wow.
Okay, there are many different types of HPV. So this HPV learning and teaching is not just for women, Trey. This is actually something men need to be involved in as well.
Wow. Now, symptoms. Say, for instance, you have HPV and you don't know it. Are there particular symptoms that you would suffer from?
So if you just have the HPV virus, that's why we screen every 3 to 5 years for cervical cancer, because even if you have the HPV virus and even if you have cervical changes, you may not have any symptoms at all. So that's why it's important that we catch it beforehand to catch any cervical changes that may occur so that we can take the proper steps to alleviate those changes.
Okay.
However, there are other signs and symptoms, especially if you have actual cervical cancer, like bleeding between regular periods, bleeding after you have sex, bleeding after you do. So anything that irritates that cervix can cause you to have bleeding because it's what we call friable. It's the cells have changed and become more fragile. So therefore you have bleeding. And then also bleeding after menopause. So, usually women go through menopause, 45 to 55, they start developing hot flashes, period. So if they haven't had a period for a full year, and then they start to have bleeding after they've gone through menopause, then we're concerned again for possible cervical cancer. There are so many diseases that are actually preventable. Okay, so having a healthy immune system is important because our immune system is what actually fights against viruses and diseases when we come across them. And then also, not only that, we also now have the HPV vaccine, which is good for all girls between the ages of 16 and 20, males 16 to 26 and women 11 to 26.
For more tips on how to keep a healthy cervix and just more information on cervical health awareness, you can follow Dr. Shanicka or visit her website. Website is www.drshanicka.com. That's SHANICKA. And, of course, on Facebook, Twitter, and Instagram at Dr. Shanicka, DRSHANICKA. All right, there we have it. And if you missed this interview, you can check it out on myb106.com. It'll be posted in a few minutes. All right, Dr. Shanicka, thank you so much. We'll talk next week.